Career profile I'm doing today is the job of health educator. And before I go into some of the details about what information I found, I want to talk a little bit about someone I know that held this position or worked at this job. Was my mother-in-law, and she worked for Alameda County in California, and she worked with new moms and their babies for a 2-year period. She followed them and educated them in their home. She did checkups with them to see how they were progressing. She educated the moms on care of the infant, and then ways that they could teach their baby as it got older, and expectations for development and growth, and ways that they could just enjoy having a child a little bit more rather than have it be a negative and stressful situation for them. Most of the moms were more low income, either single moms or low income working moms. So it was a job that it was stressful for her. Part of that stress came from working for Alameda County and the caseload that she carried. Some of it was a lot of driving, but she did really enjoy working with the moms, and it was not something she had originally set out to do. She trained as a nurse and worked as an emergency room nurse for many years, and then she went back to school, got a bachelor's degree, and then started working for the county, and eventually ended up in this position. So sometimes things go kind of a roundabout way that you don't expect. I'm just going to go over some of the facts that I found regarding this position. Working environment is a health educator. Health educators and community health workers work in a variety of settings, including hospitals, nonprofit organizations, government, doctor's office, private businesses, and colleges, and they generally work full-time. And a lot of the information I found lumped together health educator and community health workers, and I don't really think they're similar positions. Community health workers generally do not have a degree, and so I think there should be more of a differentiation, but from what I researched, they often were put together. Typical stressors of the job, like I already mentioned, was stressors that are typical of healthcare type jobs, and often there's a lot of paperwork and too many clients and long hours, or working long hours and weekends, and it's usually for pretty low pay. I could not find any information on typical job benefits, as in insurance and savings plan, retirement plans, things like that. Common job tasks are to teach people about behaviors that promote wellness. They develop and implement strategies that improve the health of individuals and communities. Community health workers collect data and discuss health concerns with members of specific populations or communities. The education requirements are a bachelor's degree at least. It's actually considered an entry-level position with a bachelor's degree, and advancement in the field would usually requires some kind of graduate degree. A lot of the positions I looked at required a master's degree, but there were quite a few that were PhDs that were working as a health educator. This is not typical, I don't think, of a marriage and family studies degree, but I thought it would apply. If nothing else, if you could work in an entry-level position and gain some experience in the field that maybe would benefit you looking for a different position, I just thought it sounded like something you could start off with, since this assignment was to find something you could do with a bachelor's degree. I thought a marriage and family studies degree would be useful in understanding family dynamics of the situation. When it comes to health education, you can tell people what's good and smart, but that doesn't mean it's going to be easy for them. Something like overeating might have a lot to do with the family situation. So that I think it's good to look at the family and look at how they're living when you're trying to teach someone what's a good health what's a good healthy way to live. Just briefly, the salary range, starting salary is usually about $28,000, and experienced salary range is saying up to $87,000, but I'm sure that's with a graduate degree. And just quickly, in general, according to the Bureau of Labor and Statistics, healthcare is the fastest growing industry, or one of the country's fastest growing industry, and among those occupations is healthcare educator, so it is considered healthcare. They focus on teaching patients and the public how to get and stay well. Patient education can be an effective way to control ever-increasing healthcare costs, so the demand for healthcare educators is growing. So this is a way to cut, this is a preventative thing. The occupation of health educator can expect faster than average employment growth up until 2022. So it looks pretty good overall for future employment. Thanks.